Welcome to week 7 of Strong Lungs, Strong Life. So far we've discussed the act of quitting, but have you ever wondered what you're doing to your body when you smoke? Well, this week we will look into two main organs affected by smoking, your heart and your lungs. Your lungs are air exchange organs. They're made up of tubes that branch out into small sacs called bronchioles and alveoli, where oxygen exchange takes place. Your body takes in the oxygen you breathe and uses it as fuel. When you breathe in, the sacs inflate. When you breathe out, the sacs deflate. In a healthy person, these tubes and sacs are very elastic and spongy. In a person with chronic lung disease, these sacs lose their elasticity and oxygen exchange is greatly impaired. When that happens, your body is in grave danger because we can't live without oxygen. The lungs protect themselves with a thin layer of protective mucus and by moving toxic particles out with small hair cells. In a smoker's lungs, these small hair cells, called cilia, move slower and struggle to remove harmful particles. You can't cough, sneeze, or swallow effectively to clear these toxins. They become trapped in your lungs, leading to a higher risk for numerous dangerous health problems, including heart disease, stroke, and cancer. Chronic obstructive pulmonary disease, or COPD, is usually made up of two conditions that make breathing difficult, emphysema and chronic bronchitis. When you have emphysema, the air sacs in your lungs start to deteriorate and lose their elasticity. Chronic bronchitis occurs when the lining in the tubes of your lungs swell and restrict your breathing. These conditions are directly related to smoking. In COPD, less air flows in and out of the airways because of one or more of the following. The airways and air sacs lose their elastic quality. The walls between many of the air sacs are destroyed. The walls of the airways become thick and inflamed, or the airways make more mucus than normal, which can clog them. In emphysema, the walls between many of the air sacs are damaged. As a result, the air sacs lose their shape and become floppy. This damage also can destroy the walls of the air sacs, leading to fewer and larger air sacs instead of many tiny ones. If this happens, the amount of gas exchange in the lungs is reduced. In chronic bronchitis, the lining of the airways is constantly irritated and inflamed. This causes the lining to thicken. Lots of thick mucus forms in the airways, making it difficult to breathe. Most people who have COPD have evidence of both emphysema and chronic bronchitis. Thus, the general term COPD is more accurate. The first symptoms can be so mild that people mistakenly chalk them up to getting old. COPD tends to get worse over time, but catching it early, along with good care, can help many people stay active and may slow the disease. Once COPD advances, it's much harder to treat. As the disease progresses, it becomes more difficult to breathe and clear your airway by coughing up mucus. Activities that used to be easy may cause you to become short of breath. Some other symptoms of advanced COPD include swollen legs or feet, weight loss, loss of muscle strength and endurance, headaches, commonly occurring in the morning, as well as blue or gray lips or fingernails from low oxygen levels in your blood. Barrel chest is a common finding with COPD patients. The lungs become enlarged and push the diaphragm downward, which makes it harder for the diaphragm to contract as efficiently. The chest wall becomes enlarged as well, weakening muscles in the chest, neck, and between the ribs. These are known as the accessory respiratory. Individuals will compensate by leaning forward with their arms on their knees in front of them, making it easier for them to breathe. If you are diagnosed with COPD, the best thing you can do is quit smoking. Smoking not only causes COPD in many cases, but it also speeds up the disease progression. No matter how mild or serious your COPD is, stopping smoking can provide the following benefits. It can slow the decline in your lung function. It can reduce many of the symptoms of COPD, including shortness of breath, and it can improve your quality of life. Have you ever heard of a smoker's cough? This is a typical sign of chronic bronchitis, which is one of the main problems for many patients with COPD. Inside the lungs, the small airways have swollen walls, constant oozing of mucus, and scarring. Trapped mucus can block airflow and become a breeding ground for germs. People with chronic bronchitis typically experiencing a nagging, productive cough that is worse in the morning and in colder weather. The number one cause of chronic bronchitis is heavy, long-term smoking. To be diagnosed with chronic bronchitis, you must have a cough that occurs every day for at least 3 months with sputum production. In addition, the mucus present in your lungs becomes a good breeding ground for bacteria and therefore becomes infected and discolored from bacterial overgrowth. If chronic bronchitis is suspected, a detailed physical exam will be performed and a chest x-ray may be ordered. Severe chronic bronchitis is typically treated with inhaled or oral steroids to reduce the inflammation in the lungs. In some cases, patients will require supplemental oxygen. If you have chronic bronchitis, you are much more susceptible to infections. It is important to report any changes in color, volume, or thickness of phlegm to your doctor, who may prescribe an antibiotic to treat the infection. In addition, taking measures to protect yourself against the flu virus and pneumonia by receiving vaccinations will improve your lung health. This slide lists ways to reduce your chance of getting bronchitis. First, don't smoke or quit smoking. Second, don't allow others to smoke in your home. Third, stay away from or reduce the time around things that irritate your nose, throat, lungs, such as dust or pests. Fourth, if you catch a cold, get plenty of rest. Fifth, take your medicines exactly the way your doctor instructs you. Sixth, eat a healthy diet. Seventh, wash your hands often. And eighth, do not share food, cups, glasses, or eating utensils with others. In emphysema, the tiny air sacs in the lungs that inflate to take air in and remove carbon dioxide become damaged and can't expand properly. Over time, these air sacs are destroyed completely and leave large holes in the lungs that trap air, like the gray-black area of the lungs in the picture. People with emphysema have extreme difficulty in exhaling or letting their air out. This is the fourth leading cause of death in the United States. There are several options which will provide relief from the symptoms of COPD, but there is nothing to completely cure the disease. Lifestyle modifications, such as quitting smoking, can have a major impact on the symptoms you may experience. In addition, bronchodilators may be used to relax the muscles of the airways to keep them open. Steroids are another treatment option. As previously discussed, they are used to decrease the inflammation in the airways. These can be taken as pills or as inhalers. Lastly, enrolling in a pulmonary rehabilitation program can aid in the reduction of COPD symptoms. Pulmonary rehab is a broad program that helps improve the well-being of people who have chronic, ongoing breathing problems. It doesn't replace medical therapy. Instead, it's used with medical therapy and may include exercise training, nutritional counseling, education on your lung disease or condition and how to manage it, energy conserving techniques, breathing strategies, and psychological counseling and/or group support. Additionally, completing pursed-lipped breathing and diaphragm exercises at home can be used to reduce the amount of COPD symptoms you may be experiencing. Pursed-lip breathing can reduce your work of breathing and can be completed by breathing normally through your nose, then slowly blowing the air out through your mouth with your lips in a whistle or kissing position. Make sure your exhale is longer than your inhale. Exercising your diaphragm can be completed by lying down with your knees bent or sitting in an easy chair and placing one hand on your chest and the other below your rib cage. Slowly inhale through your nose so that your stomach raises one hand. Exhale with pursed lips and tighten your stomach. The hand on your chest should not move. Do this for 5 to 10 minutes, 3 to 4 times a day. Breathing this way will become an easy and automatic. This has been said in previous weeks, but it's never too late to quit smoking. If you quit smoking before the age of 30, you can lower your risk to nearly that of someone who has never smoked. Quitting by the age of 50 halves your risk of developing the disease, and by quitting at any age, you can reduce your risk of developing lung cancer. Now I would like to take a closer look at our heart. In the following slides, we will discuss atherosclerosis, which can lead to coronary artery disease, resulting in potential for a heart attack, as well as peripheral arterial disease, which may ultimately lead to amputations of that limb. Atherosclerosis is a disease in which a waxy substance called plaque builds up in the arteries. Over time, plaque hardens and narrows your arteries. This limits the flow of oxygen-rich blood to your organs as well as to the other body parts. Your coronary arteries are the arteries found within your heart. If plaque builds up in the coronary arteries, it may lead to coronary heart disease, leading to chest pain, heart attack, heart failure, arrhythmias, or even death. Smoking is a major risk factor for heart disease. When combined with other risk factors such as unhealthy blood cholesterol levels, high blood pressures, overweight or obesity, smoking further raises the risk of heart disease. Remember, when it comes to your heart, smoking increases blood pressure, decreases exercise tolerance, and increases the risk of blood clots. Peripheral arterial disease is a condition in which plaque builds up in the arteries that carries blood to the head, organs, and limbs. Individuals with PAD are at increased risk for heart disease, heart attack, stroke, and even possibly limb amputation. Thank you for participating in Week 7 of Strong Lung, Strong Life. Today we learned about COPD and its effects on your lung tissue. In addition, we learned about the treatment options for COPD and, most importantly, that it is never too late to quit smoking to reduce your risk of pulmonary and cardiovascular disease. Thank you, and I hope to see you for Week 8.